Now let's see the actions of aldosterone. Its main role is to increase the renal tubular reabsorption of sodium. Then it causes increased renal secretion of potassium. Increased hydrogen ion secretion happens on the alpha intercalated cells of the late distal tubule and collecting duct. The main action of glucocorticoid is an anti-inflammatory action. It plays its role by inducing synthesis of lipocortin, which is an inhibitor of phospholipase A2. It also causes inhibition of inflammatory mediators like interleukin 2, and it inhibits the release of histamine and serotonin. Not only that, it stabilizes the lysosomal membranes and decreases the permeability of the capillaries. It also decreases the migration of WBC. Hence, glucocorticoid plays an important role in immunosuppression. Let's move on to action of glucocorticoids and various metabolism. In glucose metabolism, there is stimulation of gluconeogenesis and decreased glucose utilization by the cells. Hence, glucocorticoid is said to be a diabetogenic hormone. In protein metabolism, there is reduction in cellular protein and increase in liver and plasma proteins. There is increased blood amino acids, enhanced transport into the hepatic cells, and diminished transport of amino acids into extrahepatic cells. In fat metabolism, there is mobilization of fatty acids. Aldosterone is mainly regulated by potassium levels in the extracellular fluid, sodium levels, and angiotensin levels. Increased potassium ion concentration in ECF can cause increase in aldosterone secretion. Similarly, increase in angiotensin 2 concentration in ECF also results in increase in aldosterone secretion. However, increased sodium ion concentration in ECF will result in decreased aldosterone secretion. Regulation of hormones secreted by adrenal cortex involves information from higher centers being sent to the hypothalamus, and hypothalamus will release corticotropin releasing hormone, which is going to act on the anterior pituitary, resulting in secretion of adrenocorticotropic hormone. Now this ACTH will act on adrenal cortex and result in the formation of cortisol. The cortisol thus formed plays a negative feedback mechanism by which it suppresses the anterior pituitary and the hypothalamus, and thereby regulating the secretion of hormones by the adrenal cortex. How about we see some diseases, pathology and signs and symptoms and treatment now, which is related to adrenal cortex. We have Addison's disease, which is said to be a primary adrenocortical insufficiency. The pathology involves autoimmune destruction of the adrenal cortex. The signs and symptoms include hypoglycemia, anorexia and weight loss. There can be hyperkalemia, that is increase in serum potassium level. Then we have hypotension, metabolic acidosis and hyperpigmentation. The treatment involves replacement of the glucocorticoids and mineralocorticoids. Then we have this secondary adrenocortical insufficiency, pathology being primary deficiency of adrenocorticotropic hormone, and signs and symptoms are similar to Addison's except they don't have hyperpigmentation. Cushing syndrome is one of the commonest endocrine abnormality which we can endure in our clinical life. Pathology includes excess exogenous glucocorticoids. This will result in hyperplasia of the adrenal glands, and there can be hypersecretion of adrenocorticotropic hormone. The signs and symptoms include moon-like facies, buffalo hump, there will be purplish striae, and hyperglycemia and increased protein catabolism. There will be central obesity and poor wound healing, and there can be virilization of women and hypertension. Treatment includes, of course, treating the cause, that is removal of tumor if present, or drugs that block steroidogenesis such as metronidazole, ketoconazole and aminoglutamide are used. When there is excess glucocorticoid given exogenously, it has to be tapered or adjusted. Conn's syndrome is also called primary hyperaldosteronism. It can be caused by aldosterone secreting tumor. The patients can have hypertension, hypokalemia, metabolic alkalosis, decreased renin levels, and there can be slight increase in extracellular fluid and blood volume. The treatment involves removal of the tumor, and pharmacological antagonism of the mineralocorticoid receptor is done with the drug called spironolactone. Then we have this adrenogenital syndrome, which results from androgen secreting adrenocortical tumor. In males, this can cause intense masculinizing effects, and in female, it can cause virilization. Moving on to adrenal medulla, I have already mentioned that adrenal medulla secretes catecholamines. The catecholamines include adrenaline, noradrenaline, and dopamine. They are synthesized from tyrosine. They can also be formed from phenylalanine.